and I am the Pennsylvania Community Volunteer Ambassador for NORD. I am also a undiagnosed ultra rare patient who is a participant in the NIH's Undiagnosed Disease Network, as is my 10-year-old daughter. And I am also a Undiagnosed Disease Network Foundation peer member. And today I will be sharing my mental health story, as well as we have two therapists here that will be sharing strategies for coping for adults and children. Next slide. Just a little housekeeping. So NORD and its volunteers are not medical providers or legal counsel, and thus cannot advise on any legal matters or make any medical recommendations. Also, given the time at the end, we'll have time for questions. So if you have any questions, just please put them in the chat. Next slide. So my mental health story, I often feel like when living undiagnosed with an ultra rare disease is like being in a kayak during a Category 5 hurricane. It's very uncertain, it's very tumultuous. And I think if I could describe my mental health story in two phrases, it would be there's nothing wrong, or it's anxiety and stress. And you'll see these themes come out during my mental health story. When I think back about my mental health story, it really began when I was 17, and I felt very nauseous, and it was really interfering with my school work and my social life. And my mom took me to my doctor, and the doctor thought it sounded like social anxiety disorder, and I was prescribed Paxil. And unfortunately, this was before the FDA had issued a black box warning stating that in my age group that it could cause depression and suicidal ideation. And I did, in fact, experience those things. Thankfully, I was able to recognize what was going on and was able to tell my mom that I knew something was wrong. I did not have social anxiety disorder. I actually have what is known as gastroparesis, or delayed stomach emptying, and that's why I felt so nauseous. But I was able to continue on. I went and got my bachelor's degree in biochemistry from the University of Delaware, and then I received a full fellowship to the University of Pennsylvania School of Medicine, where I was pursuing a biomedical PhD in epigenetics. And really, in graduate school is where a lot of my symptoms began to worsen, and new ones manifested. And it was during graduate school that I fainted for the first time. And when I fainted, I thought that, I was just under a lot of stress. And, it was no big deal. And then at one point I was hospitalized for elevated liver enzymes, and I fainted again. And it was clear that there was something wrong. We just didn't know what was wrong. None of the doctors knew what was wrong. And, at this point, I made the difficult decision to leave graduate school. I also was a ballet dancer, and I stopped dancing at that time. And this was one of the most difficult decisions that I had to make. And there really was like a sadness that permeated my life for years as a dream that was left unfulfilled. This sadness was only exacerbated by multiple doctors telling me that there was nothing wrong, or it was psychosomatic. I didn't want to be sick, and yet I found myself fighting for doctors to believe that there was something wrong, which is very difficult for you to mentally wrap your head around. And that basically led to a lot of tears and fighting with my husband. But I kept forging on my diagnostic odyssey. And because of my strong support systems, my faith in God, my husband, my friends, um, I was able to keep going. And my husband and I had have a beautiful daughter named Bridget. And that's when things took a dramatic turn. As I mentioned, living undiagnosed feels like you're in the middle of a storm. And when my daughter was 3, I started noticing similar symptoms in her. And it felt like someone stabbed me in the heart. This was again difficult for me mentally. I did not want my daughter to be sick, especially with whatever I had. However, I couldn't bury my head in the sand. I knew I had to help her. And that's when, in the fall of 2021, I applied to the Undiagnosed Disease Network, where she was accepted as a participant. I also was asked to be a participant, but I was initially hesitant because of my past medical experiences. I have faced many challenges while living with an ultra rare yet to be discovered disease for over a decade. When my daughter was young and was experiencing her own medical issues, I had to get a letter from my physician so she could have a caregiver. And in that letter, the physician had to write that I was not physically able to care for my daughter. This again was difficult because at this point I had accepted that I couldn't be a scientist, I couldn't be a ballet dancer anymore, but I could be a mom and I could be a wife. And in this moment, when I got this letter, I felt like my motherhood was being stripped away from me. And I found myself questioning, who am I? Another challenge that I faced was when I was on hospice. That was very difficult because I felt like everyone was waiting for me to die. And I remember thinking to myself, am I just supposed to resign myself to death? And also, I've experienced multiple episodes of medical trauma, including recently, where I was told by a doctor that they were uncomfortable with my undiagnosed status and would not be treating me. This was, again, very difficult mentally for me to process. But in addition, I have also had to wrestle with the fact that science, one of my loves, has not been able to fix me as of yet. That unlike ballet, where you are given a correction and are able to fix the problem, I am unable to fix this. And lastly, a mother's guilt for giving my daughter this disease. Over the years, I've learned to cope with the uncertainty of living with an undiagnosed disease. I allow myself to have what I call an emotional temper tantrum for 2 to 3 days, and then with the help of my various supports, I pick myself up and make a plan to move forward. I don't look back. I just keep moving forward like a horse running the Kentucky Derby. You see, I believe when we encounter suffering, we have 2 choices. We can respond in anger and bitterness, or we can respond in compassion. Compassion for ourselves, compassion for others. And for me, I will always choose love. This is why I volunteer with NORD and the Undiagnosed Disease Network as an act of love and compassion for strangers navigating these uncharted waters of living with a undiagnosed or rare disease. I saw this image that's on my slide during our vacation this summer, and I had to take a picture of it because I thought it was very fitting for my diagnostic odyssey. Anytime I'm having a difficult day, I look back at this picture and remember, above all, don't give up the ship. Thank you so much for allowing me to share my story. Next up, we have Nicole Wheeler, also known as Nikki. She is a nationally certified counselor and licensed professional counselor from the Western Pennsylvania, Greater Pittsburgh area. She graduated with her Bachelor's of Science in Psychology from Slippery Rock University and her Master's of Arts in Clinical Counseling from Waynesburg University. Nikki has endured one rare disease of narcolepsy and one ultra rare disease of juvenile onset hypophosphatasia. Although these conditions have been a challenge, Nikki has had the passion and determination to fulfill her goals as an advocate for others and to become a counselor. HPP, or hypophosphatasia, is a metabolic skeletal dysplasia disorder where one lacks alkaline phosphatase to break down minerals and vitamins for one's organs, muscles, and bones. Due to toxic levels of B6 in the blood, it can cause chemical imbalances in the brain. As a result, Nikki has recovered from her own mental health challenges and has become specialized in obsessive compulsive disorder, particularly with excoriation disorder, also known as skin picking, and trichotillomania, also known as hair pulling. Nikki is ambassador for the Trichotillomania, it's a hard word to say, Learning Center. She has written an article in the book Project Dermatillomania, written on her skin, and has presented at the Pennsylvania Counseling Association, along with the Dr. Oz show. Nikki has a long work history in social services, including nursing homes, group homes, juvenile delinquency centers, forensic centers, and the community center. She currently practices with growth therapy, and her approach is mainly exposure response prevention, along with comb methods. Thank you so much, Nikki.
All right, thank you. Can you guys hear me okay? All right. So yeah, in a snapshot, that is me. Next slide. Thank you very much for sharing, Christine. That was a heart-wrenching story. I get it. So this is my biography in a snapshot. This is how you can get a hold of me. These are my booking links and also my email. I do have two rare diseases, like Christine said, narcolepsy and hypophosphatasia. She kind of described what hypophosphatasia is. Narcolepsy is the inability to be able to control your sleep-wake cycle, resulting in falling asleep at inappropriate times. Next slide, please. So I wanted to start today's presentation with my favorite quote, and that is, "You are the author of your own life story," because that is essentially correct. So even though we have these things that happen to us, we are the author of our own life story. It is our perspective and what we make of it that is going to matter. Another quote that I like from John Kabat-Zinn, he is the author of the book, "Wherever You Go, There You Are." This is my favorite book for counseling. And one of his quotes is, "To develop a mind that clings to nothing, be the light unto yourself." And I will explain that more later in the presentation. Next slide, please. Okay, so these are the statistics around rare disease. So many of you may already know that 1 in 2,000 people that are affected by that disease is considered a rare disease. 1 in 10 people have the one of 7,000 currently recognized rare diseases, 80% of them being children. There are 150 to 200 new rare diseases identified each year. 10% of Americans suffer from it, and 29 million of the European Union. It takes, on average, 9 years to get diagnosed. For me, it was 41 years, so a very long time. 40% of parents with undiagnosed children develop mild to moderate anxiety and depression. There's, of course, a higher risk of anxiety and depression, fatigue, pain, and impaired physical functioning. 12 to 25% of those with a life-threatening disease develop post-traumatic stress disorder. Like Christine mentioned, there's a lot of medical trauma that goes along with this process. Only 5% of people get effective treatment. And like Christine explained, many people that have an undiagnosed disease are initially told that there is some sort of psychotic condition going on or anxiety or depression, making you think that it's all in your head when it's not. Next slide, please. Okay, so for this slide, I kind of wanted to hear from everybody else. There's so many different multifaceted aspects that come into why we as undiagnosed or rare disease conditions become stressed out. So I kind of wanted to hear in the chat, what is most stressful to you as far as being undiagnosed or having a rare disease? All the unknowns. Yes, there's a lot of anxiety with not knowing what your future brings. Nobody understanding. Yes, the isolation, not feeling that people care, people not understanding, people not being educated. And that includes medical professionals. People thinking you're exaggerating, being unvalidated. Yes, my disease is a metabolic disease, so I understand the whole having issues with food, not knowing what you can eat, not knowing what your reaction is going to be. Doctors that want to fit you into a textbook. Yes, that's why we have the zebra icon, because a lot of times doctors want to give you an easy, simple answer and don't look outside the box. Looking fine, but feeling horrible. The invisible diseases. Yes. Okay. So other things, multiple doctor's appointments, multiple specialists, multiple treatments, the lengthy diagnostic odyssey, so taking forever to get a diagnosis, having to travel to specialists far away from you, multiple absences from work and school, us having to be the burden of coordination of care and research. With my disease, I was the one that actually found it and asked to be tested for it. Financial distress from meds, treatments, copays, accommodations, the disability process. I could do a whole training on that. We talked about social isolation, relying on others for care, limited leisure activities, all kinds of feelings that go, all kinds of emotions that go with having a disease. Family and relational stressors. So having one person with that rare disease causes the other family members to kind of get neglected. That can cause a lot of stress and tension. All right, next slide, please. So when I was doing my research for this presentation, I came across the Care Family Net study. And what they did is they interviewed a lot of people that had a rare disease or undiagnosed disease and tried to come up with what are some of the patterns that people were seeing. So what they found is a lot with daily life experience is having to have the strict structure of medical intervention. So medications, oxygen treatments, changing equipment, taking care of equipment, all of that takes time. Inability to have a normal life, dependence on others, unpredictability of symptoms. You can never plan with a rare disease. There's always things that come up. Financial strains, strained family relationships, and social isolation. Their experience in the healthcare system, the delayed diagnosis, multiple appointments, inadequate care. A big thing that came up was separation of family. So if you have a child that is having health issues. A lot of time they have to go to the NICU or some sort of special treatment, but there's no accommodation for the families. The families can't stay there, or it's uncomfortable in the hospital room. So there's this separation that causes medical trauma. Um, Unempathetic clinicians and an overwhelmed healthcare system. So when it comes to being able to um, get psychosocial services, hold on, I had a pop-up come on my screen here. What they found is that the doctors and medical professionals were not offering the psychosocial services. So that people didn't even know that it was available. So any kind of support groups, any kind of therapy, family therapy, blended case managers, none of that was made available to them. A lot of times people feared further stigmatization. They've been already told that it's all in their head. So why do they want to go to therapy now? Untrained mental health professionals. There's not a lot of mental health professionals that are trained in chronic illness or rare disease. And if they are, they're far away, or there's long wait lists, or there's inaccessibility to them. Other barriers to psychosocial supports is people having the time. They already have all of their time taken up with medical appointments. It's hard to get to a counseling appointment. Again, location, travel, wait lists, cultural barriers. Some families, depending on what culture they're in, they're interfamily dependent. They don't believe in going to counseling, or there's that big stigma there again. And lack of holistic family treatment. So it's easier to get into individual therapy, but what about the rest of the family? This disease affects everyone. Another research article that I came across was a literature review, and essentially what they found was parents with a more timely positive diagnostic delivery with adequate understandable info, support, and compassion, and a plan were more able to cope, which influenced how their child also adjusted to their disease as opposed to parents falling apart. Okay, next slide, please. All right, so one of the aspects of dealing with a rare disease is grief. So grief is not just someone passing away, it's the loss of anything. So like Christine said, she had the grief of losing her career, losing, being a mother, losing her physical abilities. There's a lot of grief that comes with having a rare disease. Of course, with grief, there's your 5 different phases. You have denial, anger, bargaining, depression, and acceptance. Unfortunately, with rare disease, what Rhonda Thorrington found is that we have what's called ambiguous grief. So with rare disease or undiagnosed disease, we have continuous grief. It's not just a one-time occurrence. It's constant feeling like we're losing things. Next slide, please. Okay, so I just have this slide up for everybody's information that there are all kinds of different types of therapies out there. So there is something out there for you. Next slide. Okay, so how do we cope with having a rare disease? The number one thing that I stress more than anything is having support there. So making sure you're surrounding yourself with those that support you, getting into the support groups, Facebook, NORD, UDN, patients for your specific disease, patient groups, anything that you can get into to normalize your experience. Journaling. Writing down everything so that you remember everything, having someone go with you to your appointments so that they can remember things and help you out and keep you on top of your care also. Knowing your resources, so getting signed up for whatever's out there for you. There's no shame in signing up for help. I like to stress expressive arts, and that's part of the meaning making we're going to be talking about in a minute here. Is do what you need to to fuel your soul. So if that's art, if that's writing a poem, writing a story, if that's advocating, if that's speaking, public speaking, whatever is going to help you. And make sure you have boundaries. So I know a lot of us do our own research to help with the rare disease, but make sure that you are being aware of how much your own research is affecting you. So Google Doc can have a lot of negative in it and can affect us negatively. So know when to step away from the iPad or laptop. Okay, next slide, please. Okay, so the primary approach for chronic illnesses is what's called mindfulness-based CBT, and that's my primary approach for any of my clients. Um, so what is mindfulness-based CBT? So mindfulness, according to John Kabat-Zinn, is the awareness that arises from paying attention on purpose in the present moment and non-judgment, being in touch with the not knowing. So it's important for us to realize one, radical acceptance, being able to accept what we can't control, and two, not being attached to any certain outcomes. So anxiety and depression come from either we're living in the past or we're living in the future. So being able to be in the present moment, non-judgmentally, riding the waves, just on your path of life and just taking everything in, that is mindfulness. So with mindfulness is a lot of meditation. So meditation is about being yourself, coming to realize that you are on a path. Non-attachment and acceptance is the practice of being calm and okay if something doesn't go our way. Healing is coming to terms with things as they are. So all of these quotes, most of them come from that book that I mentioned earlier, Wherever You Go, There You Are. I can't stress this enough. I love it. So mindfulness, it'll result in overall well-being, self-compassion, gratefulness, meaning-making, resilience, and feeling like you're part of a whole in the world. Some of the skills that you can learn are a mindfulness flow activity, your arts, gardening, just going for a walk, things that do not take a lot of thought. Loving kindness meditations is your mantras. So like saying the same things over and over in your head. I have the 5 remembrance in there. From that, one of the things that I say to myself sometimes is, I am okay, I am safe, I am healthy. Sometimes we are not healthy, but if I'm having a panic attack because I'm thinking about, all of my symptoms too much, I will say over and over in my head, I am okay. Breathing exercises. So I want everyone for a second just to take a deep breath and notice how that feels and how you're doing it. So just take a couple seconds to do that. Okay, so I bet a lot of you kind of went, that's not a deep breath. Okay, so with 4-8 breathing, you want to breathe in to the count of 4 and breathe out to the count of 8. So in 2, 3, 4, out 2, 3, 4, 5, 6, 7, 8. And you want to do that so that you're getting rid of all of that carbon monoxide. And that will slow down your nervous system. Also, you don't want to hold your breath if you're feeling anxious because that will actually increase your heart rate. Other relaxation exercises, deep muscle relaxation, grounding exercises, guided meditation, and thought diffusion. So your grounding exercises will be, if you're getting into some anxiety, you're going to focus on an object and you're going to focus on how it feels, smells, or just focus on one thing in the room and just really ground yourself in that. Thought diffusion, a couple of examples are you can take all of your thoughts and pretend you're on the ocean, put one thought on each wave, and then pretend they wash away. You can do that with clouds. that they blow away. You can also do that with leaves on a tree. So just a couple of ideas. Next slide, please. So one of the things I go by is what's called the self model. This is my own model that I came up with. The S stands for searching. So keep searching for what's going to work for you. Also keep soul searching. Do what's going to fuel your soul. I hear a lot with rare disease is I can't do this anymore, or I can't do that anymore. You might not be able to do it the way that you used to, but you can do it differently. So with narcolepsy, I dream a lot. I actually had a dream last night that my hyperphosphatasia got so bad that I was bedbound and couldn't move a lot. And then my friends were going to a dance. And I was upset because I was like, I can't go, I'm bedbound. So what my friends did in the dream is they actually came to me and they said, okay, we're going to bring the dance to you. And so they put music on and then I just rocked in my bed. So find ways to be able to still do things. Environment, changing your environment. Again, finding ways so that you can still do things and, still be happy. Also changing, people around you, put up boundaries. I heard a lot on the chat, people not understanding. You may need to limit that contact if they're not willing to, understand or help you out more. Then you may have to put that boundary there and surround yourself more with those that are going to be helpful. And with that, you will see the love from people. And I know it gets hard to have to rely on people to help take care of you, but they're doing it because they want to. They're there for a reason. So take that love from them and, love yourself also. There's a reason that they like being around you. And the F, forgiveness. So forgive yourself for those bad days. There's going to be days where you can only lay in bed all day. That's okay. You're going to have a better day. It will pass. Okay, next slide, please. All right, so this is my last slide, and that is of meaning making. So Viktor Frankl, he was in the camps, one of the Nazi camps for being Jewish, and all of his family was killed. And he wrote a book, I can't remember the name of the book, I think Meaning of Man or something, how he made meaning out of his situation. So a couple of his quotes: what is to give light must endure burning. So in order for us to make positive out of something, we have to be able to struggle a little bit. When I went to a narcolepsy summit, one of the questions in the chat was, what is one thing you got out of narcolepsy most? And most people answered empathy for others. Al Freeman has a presentation, which I put in my resources, where he makes meaning out of his child's rare disease, which he's a psychologist himself, by watching his child's positive qualities and the support of people around him. So the compassion, resilience, perspective. His son was a pioneer and brave and trying new things, bringing out the best in each other. My meaning is being able to advocate, being able to be a counselor. Now that I'm only working like one day a week, I have more quality time with my family. And I can spend more time with other interests like scrapbooking. I love scrapbooking. So now I have more time for that. Most importantly, my child learning from me. She loves to be around people that are in wheelchairs, walkers, that are autistic. She is really learning to be open-minded and love everyone. So that's just awesome to watch. So everyone's meaning is unique to them. Next slide, please. All right, so I put this up there. There is a rare illness support group if anybody wants to join it, and I think it is free. And that is it. Thank you for joining me.
Thank you so much, Nikki. And should have mentioned in the housekeeping section that the slides will be sent out. So you will have access to all that information. I think over the years of living with an undiagnosed disease, I've learned to accept and focus on the things that I can do and not the things that I can't do.
Yes.
So thank you so much. Next up is Katie. Katie E. has been working as a certified child life specialist for 35 years and a licensed social worker for 12 years. She has provided children and their families psychosocial care, developmentally supportive and therapeutic interventions, and anticipatory grief and bereavement counseling in a variety of healthcare settings. She has worked at Morgan Stanley Children's Hospital, affiliated with Columbian Presbyterian Health System on the Child Life team at Temple University and on the palliative care team. She currently works at the Children's and Young Bereavement Counselor for the Mainline Health System in their home care, palliative care, and hospice program. She has worked in specialized foster care for Leak and Watts in Yonkers, New York, caring for infants and toddlers whose parents struggled with substance use disorders, and in community-based early intervention for Ken Crest Services in Philadelphia, Pennsylvania, as their clinical programs director. Katie is passionate about providing optimal patient, person, and family-centered care to the adult patients and their children, grandchildren, and/or great-grandchildren, and creating opportunities for legacy building that fosters continuing bonds. Thank you so much, Katie, for joining us today.
Thank you, Christine and Nicole, for inviting me to align with the two of you and speaking to the NORD community. I have lots of information on the slide, and I will speak as clearly. I can talk fast, but I'm going to try to pace it. So next slide, please. I just wanted to share, because this is really the essence, as we all know, for children and how they cope best is through play. It also is actually, as Nicole shared very nicely, really important for us also as adults to take care of ourselves and nurture ourselves. And this quote comes from Erik Erikson, who many of you may know was one of the most influential psychoanalysts of the 20th century. And I just think it is just so important when we talk about healthy coping. To play out is the most natural autotherapeutic measure childhood affords. Whatever other roles play may have in a child's development, the child uses it to make up for defeats, sufferings, and frustrations. And we do know all children, thankfully, are capable of playing, and hopefully all the adults in their lives are wanting to play alongside them. Next slide, please. I think you all are probably already at this place, but I just like to mention, because I am a children's and young adult bereavement counselor, one of the key things that we talk about in the grief and loss world, whether it's a death loss or a secondary loss, as many of you are coping with either yourselves or with your children, is the acknowledgement. And that is something that I think our society struggles with, even when people are dealing with loss, whether death or secondary. We want to fix something. And the reality is we need to first acknowledge and we need to support. And, you know, acknowledging that you are now on this different journey, which again, many of you, I saw some of the chat messages, it's taken many years for your diagnosis to be figured out. And some of you, I know, like Christine, are still, and her wonderful young daughter, Bridget, are still waiting. And just knowing that knowledge, as we know, is empowering and helping us as parents and caregivers for our child or children to feel more in control of your disease trajectory as possible. Next slide, please. This was a study that I had read recently that talks about the stress and well-being amongst parents of children with rare diseases. And, you know, they said essentially parents of children with rare diseases play, as we know, is crucial in their development emotionally and physically when children are struggling with rare disease. Next slide, please. This ARQ model of grief support, and again, why I mention this, as Nicole had very nicely shared, when you are coping with a rare and undiagnosed disease, we are dealing with ambiguous loss or secondary loss, and looking at it in a framework of awareness, reflection, and questions, it can help create meaningful and supportive interactions for children and adults who are obviously also grieving this new normal reality. And so, cultivating an awareness of your own experiences with grief and how they may shape your expectations, being able to reflect upon what your child or children say and do, to be able to have effective responses in understanding what our children think and feel, and reflecting, what you see and hear. And this is just a way of sort of, active listening and emotional validation. And again, there is a lot more information. This website, the National Alliance for Children and Their Families, Grieving Children and Their Families, does have, information that deals with aspects of secondary loss, not just death loss. Next slide, please. Again, having toolkits for building resilience and fostering healthy coping. I'm sure all of you are already doing this, but encouraging your child's unique talents and interests, finding those passions, promoting positive social interactions, in terms of, consistency and clear expectations, trying to reduce the sense of blame and guilt, that your child may feel, or you may feel. Practicing positive stress management, as Nicole shared many wonderful mindfulness strategies, and I will talk about some of the same that we can do with our children. And of course, increasing and fostering, increasing hope, always believing in that aspect of hope, which I know is easier said than done. And again, helping our children label their emotions, how they are feeling in that moment, being able to put a name on what emotion they're feeling. And as we know, many of us, adults and children, feel many emotions at one time. We may be happy and sad, or mad and, happy at the same time. And we know resilience, is the key in successful coping with adverse childhood experiences, the ACEs, which a lot of research has been done in the last 25 years. Medical issues. And again, this is not blaming anyone for what diagnosis they may have, acute or chronic, but we know that, children who have adverse childhood experiences, it does not mean they are going to necessarily end up with significant mental health or other things. But, we know it's important for them to be able to be validated, to be able to have some normalization and strategies, to foster that resiliency. Next slide, please. I also know that there can be limitations. One of the things that I find that's often very helpful when children are really struggling to acknowledge or say what they need to say is to use art. Again, as Nicole mentioned, expressive arts is a really healthy way for coping. In terms of, having children first maybe draw out or write out the fear, and second, their wish. And we know often using nonverbal communication can give children of any age the distance, time, and creative means of emotional expression. Sometimes that's difficult to share through talking. Another thing is to use dolls or action figures, stuffed animals in role play, and letting the child guide the conversation. When I worked as a child life specialist in children's hospitals, often the child wanted to talk to, my stuffed animal or my puppet, as opposed to me directly. And again, it gives them control and mastery over the situation. And it's also important because it often can help us as parents and caregivers, see where there may be misperceptions of a child's understanding of their diagnosis or illness, and, get a better understanding of what they are struggling with in terms of their disease progression. Next slide, please. And again, these are just some quotes that I think are really important, reminding us about how play opportunities promote that sense of mastery, and we know optimal development and a significant understanding of our life experiences. Play is the training for the unexpected, from Mark Benoff, who is a well-known child psychologist. And many of you are probably familiar with Maria Montessori, hence the person who had the philosophy originally in Germany that came to America over 100 years ago for the Montessori philosophy of schools. And she said, play is the work of the child, and it truly is. Next slide, please. Some suggestions for healthy coping strategies. And again, these are just suggestions. Rehearsing, role playing can help children feel more prepared for new situations, such as medical appointments, allowing your child before they go maybe to see a new doctor, or a new experience. It may be even also before they're starting a new grade at school, or going to, an after school activity, where they may have anxiety around, their disease, also just around, all children can struggle with social anxiety and other aspects that, can be normalized by us as parents. To provide, distraction activities, things such as electronic games can help children escape from stress. Although I will say that I'm not a big believer in spending hours on end. We live in obviously a very tech driven culture, and it is important, I think, to decompress. I do support young adults and talk about that, particularly if they're struggling with sleep, and just, being able to do other things. Mindfulness, even making things like, this is a calming tube that was made out of a water bottle. You don't even have to buy the ones that are store-bought, but this is an activity I do with a lot of my clients, and adult and child, and they find it to be very soothing. Deep breathing, as Nicole illustrated beautifully, can help reduce anxiety. And as she said, it's not just a quick breath in and out. It's really, there is a mindfulness strategy of the 4-second rule of breathing in and the 8-second rule of breathing out. We know that physical activity, again, there may be limitations for your specific child or children, and that's completely understandable. But whatever they may be able to do, maybe, things that are on the ground activities are not, something that they're able to do, but maybe they can do something in water. Many children I know who sometimes have physical limitations due to disease trajectories are able to do things, where there's more buoyancy. Social interactions with family and friends, talking about their illness. And when I say that too, is also emphasizing that, their disease is only one part of who they are. And I know that this is really essential because, we don't want our children, as you all know, to be defined by, their illness is a part of them, but it is not the only part of them, and that is so important. And I think as a society, we are getting better at recognizing that we all fall on different spectrum, excuse me. And then again, that ties into that strengths-based model, and, developing other strategies as you feel that are healthy. Next slide, please. Superheroes are something I love, and again, this is more usually with younger children, but talking about positive coping and asking a child to imagine if they were a superhero, with cool powers, who would they be? And again, suggesting they draw themselves, as that superhero. They might make a shield, and, what is their superhero power? Again, letting them realize that they have innately within them the ability to, do a lot of things despite their rare disease or undiagnosed illness, and finding out what matters to them. Imaginary play and magical thinking are also very healthy coping mechanisms. And, we as adults often utilize these. The great author Joan Didion wrote a book about her profound grief and loss. She is now deceased, but about 15 years ago, called The Year of Magical Thinking, after her spouse died, and then her young adult daughter died unexpectedly within an 18-month period. I highly recommend that book, as I think Virginia is Virginia is also saying, it really gives credence to the fact that we all as adults need to go into that, I have as well, Virginia, magical thinking world sometimes when things get really hard for all of us. Next slide, please. Calming down activities. Again, these are just suggestions, and you all may be doing these things. Quiet reading, again, and I say quiet reading ideally from a book, not from a tablet or, a technology device. Again, I'm not judging if your child does better and needs the assistive technology. By all means, whatever is the best way for your child. Warm baths, if possible. Again, that I know is not necessarily true for all children. Adding bubbles, Epsom salts, or essential oils. Again, if that is something your child's able to do. This other suggestion may sound a little bit messy. It's better than, I will say, sand play, but many times children, again, if they like textures, using rice and beans to put them in a bowl and uncooked rice or beans, and then letting your child, play with like measuring cups and running it through their hands, believe it or not. And, some people prefer things like slime and, I'm trying to do things that are more calming down and not so messy. Coloring, is another great thing. Baby burrito is not really always for babies, but that aspect of, being able to wrap your child and swaddle them, or just, laying next to them. Again, deep breaths and grounding activities, as Nicole mentioned, the 5 senses of being able to focus on something you can see, something you can hear, taste, touch, and smell. And also, again, if your child is receptive, I know some children and teenagers and young adults are not always, they don't always want that physical interaction, but to be able to provide that personal connection with physical pressure or touch, and, different things, that even massage that is just, a gentle, firm touch, or maybe it needs to be a light touch. Next slide, please. I just want to mention, and I know our time is getting limited, that if any of you are not familiar, the slumberkins.com is a wonderful website, wonderful organization that was started about 15 years ago by 2 mothers. And they have wonderful resources that deal with every aspect of social emotional development for children from like 0 to 18. They have wonderful books like Honey Bear, I'm Grateful for You, Otter's Heart Family. But more importantly, you don't have to buy materials. There are things for parents and educators and those that support children, teens, and young adults to download for free. There are stories. They have wonderful stuffed animals like this friend Sprite, who is one of their grief buddies. They talk about things like the special paper dowels and paper chains. And what I will say, paper chains, depending on your age in this group, I'm 59, is something that's been around at least since I was a child. They do it with dowels, but just even having children take colored paper, if you have it, your child, and writing on each chain a name of a person that they feel connected to, and then taping or gluing those or stapling those and making that paper chain can really be empowering. And again, I know these sound like simplistic maybe activities, but they really can have an impact for our children when we just want to keep reminding them about connection. Next slide, please. Again, letting go, bubble play, going outside with bubbles, again, if possible, or a wand, blowing the bubbles. Again, this gets into the mindfulness and breathing, having children take a deep breath, blow out, and then asking them about the emotions they're feeling. And, or if they're exhaling through the wand, to release those feelings and let those feelings go away. And as the bubbles pop, imagine their feelings disappearing. And again, this is just supportive guidance. Next slide, please. Again, sometimes, again, children may tell you one thing, as you all know, about what they're feeling, but they may be actually internalizing things differently. And again, getting back to drawing a picture of their face, wearing the mask they choose to show people. and in one box, and then in the other box, drawing a picture of their face with a mask of their feelings that they keep inside and they might not let others see, or maybe they only let you see, or other close family members. And this can create a supportive space to talk about those emotions that our children may keep internalized. And, surprisingly, even children that we feel that may be coping just fine, have these issues, and often need to be able just to have that safe space to, again, through expressive arts, share what's really happening. Next slide, please. And again, these questions here, just thinking about utilizing emotional expression, what makes you happy, scared, sad, and angry. And again, of course, with your individual child or children, you know what their strengths are, where their limitations may be. Next slide, please. Again, I talked about the grounding. Some of these exercises come from Katie Hurley's book, The Stress Buster Workbook. Definitely recommend. Next slide, please. Again, these are just some suggestions to reduce, the negative impact, listening, informing your child, rehearsing, again, emphasizing strengths, and again, letting them know that they can be in control of some aspects of each healthcare related event or situation. Next slide, please. And again, this is one of the key things I feel is teaching our children to be their own advocate, encouraging independence as much as possible, depending on not only their developmental age and their not just chronological age, but developmental age. Encourage self-awareness, encouraging our kids to work or volunteer, again, as depending age dependent. Encourage your child to dream big. Everyone should always have hope. Encourage choices as much as possible, and encourage connections. Next slide, please. And I just wanted to end on this quote I found recently, which I really love, that said, "Believe in yourself and all that you are, knowing that there is something inside of you that is greater than any obstacle." Thank you again. My contact information is on the last slide. And I'm sorry, I know that there were some questions, so I can go into the chat and I will try to answer some of those or feel free to speak. I'm so sorry.
Thank you so much, Katie. Yeah, I think there was just one question from Paula. She was asking about her 19-year-old who's facing the loss of a life that she envisioned as she watches peers go off to college while she is getting fitted for a wheelchair and facing progressive paralysis. So do you have any suggestions for where she can go or how to cope with this?
Yeah, I am so sorry, Paula, that your daughter is facing that right now as a young adult woman. That is so hard. Yes, and that falls into, as we know, and you know better than I, the secondary losses. I would say, if you're able to find a support group, the one thing that I will say that, and I think we know anyone who's had teenagers and young adults in their lives, whether personally or professionally, finding other peers is essential. As you said, as her friends are going off to school, or, going on or just finding another person, if that's something she's receptive to, because that in itself, the peer-to-peer support in my professional and personal experiences is invaluable. It validates you're not alone, even if that person doesn't have the exact rare undiagnosed disease as your daughter is coping with. Again, this is just gentle guidance. If your daughter is receptive to talking to, a professional, just again, to know, even for, not that there's anything wrong. We emphasize all the time that, counseling can be one of the healthiest things we do. There's such misconceptions about therapy out there. And I obviously personally believe, I've been there on that path myself, the best gift we can give ourselves. So again, that's also something I would suggest. And feel free to talk to me offline with my information if you'd like to talk more, in the interest of time. Thank you.
Thank you so much, Katie. I just wanted to mention to save the date for Pennsylvania's virtual Rare Disease Day, which will be February 21st, 2025, from 12 to 1. I'm actually looking for a rare disease patient or parent to share either their or their child's story. So in the follow-up email, I'll make sure my email's included there. If you're interested in this. And also just wanted to mention on World Mental Health Day, which is October 10th, from 10:30 to 11:30 Eastern time, I will be a panelist for Alex Therapeutics webinar on addressing mental health in the rare disease community. So I just want to say thank you to everyone, and I hope everyone has a wonderful day.
Thank you all. Thanks, Christine. Thanks, Nicole. Thank you all. Bye-bye.